Premier Doug Ford is making an announcement this morning in Hamilton. Let's listen in live.
For Hamilton and Minister Lumsden and MPP Skelly, they both do an incredible job. I also want to acknowledge David. David, thank you for everything you do day in and day out, along with Susan and Paul and James and the entire team at McMaster University for hosting us today. And I was thrilled to hear that McMaster was once again recognized this week as one of the world's top 50 universities for the study of life sciences and medicine. Just think of that, folks. Top 50 in the entire world. I always say our #1 selling feature when Vic and I travel around selling Ontario, it's the students that are coming out of our great colleges and universities. That's our #1 selling feature, and again, we appreciate everything you do, David, right here at McMaster. Congratulations on this tremendous achievement, and we're so proud of you. And thank you for all you do to train the next generation of doctors, nurses, and healthcare workers. My friends, when it comes to healthcare, we know that the status quo is no longer acceptable. Too many people are waiting too long for surgeries, having to travel too far to see a doctor, or spending too much time navigating our healthcare system. That's why, earlier this year, we introduced our government's Your Health Plan, a plan to connect people to more convenient care, all while using their OHIP card, never their credit card. This plan builds on our government's historic investments in new hospital beds, long-term care beds, and mental health and addiction services. It expands access to home care services, community paramedicine, and allows pharmacists to provide more care at no extra cost. Our goal is simple. Whether it's an emergency in the middle of the night or a problem that's been bothering you for years, no matter where you live, we want to connect you to more convenient care closer to home. But my friends, as we expand our healthcare system, we need more doctors, nurses, and healthcare staff, and we've made progress. Since 2018, over 60,000, I'm going to repeat that, over 60,000 new nurses and nearly 8,000 new doctors have registered to work in Ontario. In fact, last year was a record-breaking year for new nurses in Ontario, with over 12,000 new nurses registered and ready to work, and another 30,000 nurses studying at a college or university. But we know we need to do more, and we're doing more. Today, we're pleased to announce that as part of our budget 2023, we're investing $33 million to add an additional 100 undergraduate medical school seats and 154 postgraduate medical training seats. That prioritizes Ontario residents. Friends, one of the things I hear all the time from families is that a lot of students are being forced to leave the province for medical school. You hear it, my son or daughter's in Ireland, or they're down in the Caribbean at medical school because they can't find a residency spots right here in Ontario. Meanwhile, students from other countries are learning here, but then they return home after that, and I find that unacceptable. That's why we're expanding the number of undergraduate and graduate medical school spots and putting qualified Ontario students at the front of the line. We're training the next generation of Ontario doctors right here in Ontario to stay here and care for Ontario communities. The new investment is part of our government's major expansion of medical education in Ontario, the largest expansion of our medical school system in more than a decade, and is just one of the many steps we're taking to bolster our healthcare workforce. We've expanded our Learn and Stay grant program, which pays the full cost of tuition, books, and other supplies for students in high-demand fields, including nurses, paramedics, and lab techs, in return for agreeing to work in an underserviced area of the province. We've broken down barriers so more internationally educated nurses and doctors can put down roots here and help care for our province. And we've introduced legislation to allow Canadian healthcare workers that are registered or licensed in another province or territory to practice in Ontario immediately without having to register again. Together, these changes will increase the number of healthcare workers in our province for today and tomorrow, providing a pipeline of talent and reinforcements. My friends, as I said before, the status quo is not acceptable. We're being bold, we're being innovative, and we're being creative. We're working hand in hand with our colleges, universities, and our healthcare partners to build our healthcare workforce, to ensure you're connected to healthcare you need when you need it. Thank you again for joining us today, and may God bless the people of Ontario.